Men, there's no two ways about it. You need to get your prostate checked. A small organ the size of a lime, your prostate sits at the base of your bladder surrounding your urethra. During your reproductive years, it plays an important role in producing the seminal fluid that nurses the sperm and is essential for fertilization. Later in life, however, the prostate undergoes changes that can be problematic. It causes obstruction in urinary flow and leading to increased urinary frequency. Prostate cancer is also increasingly likely after the age of 40, which is why regular checkups are essential. Whether you have symptoms or not, our practitioners, all experts in the field, will use the most advanced tests available to make sure we diagnose and treat any problems as early as possible. So let's run through just some of the problems we deal with here at the Man Centers on a day-to-day basis. If you find yourself with increased urinary frequency, especially if you regularly have to get up during the night, slow urinary flow, or post-void urinary dribbling, bladder pain or pressure, you can have an enlarged prostate squeezing on the urethra and placing additional pressure onto the bladder. An enlarged prostate also makes you susceptible to urinary tract infections, which can lead to prostatitis, a serious inflammation of the prostate. So it's important to begin treatment as soon as possible. Our clinicians will assess your condition and may prescribe medication to relax and shrink the prostate. In some cases, we may also recommend one of a number of surgical procedures designed to open up the internal prostatic urethra. TURP is one of the most effective procedures. Carried out under a light general anesthesia, we pass a scope through the urethra and use a laser or heat to remove the parts of the prostate that are causing the obstruction. Increased urinary frequency or bladder pain could also be a sign of a prostate infection. Other associated symptoms include a burning sensation when you urinate, pain in the pelvis or groin or testicles, and pain when you ejaculate or discolored semen. There are two types of prostate infections, those caused by sexual activity and those that happen regardless of it. These are treated in different ways using different antibiotics, so one of the first things your practitioner will do is ask you to produce a sample for a culture to guide his treatment. We offer both oral and injectable antibiotics, and treatments can take anywhere from 2 to 6 weeks. Finally, the reason we need to check our prostate on a regular basis, even if we aren't presenting with symptoms: prostate cancer. 1 in 7 men will develop prostate cancer in their lifetime, and the risk increases with age. Men with a family history or African Americans need to be closely screened from their 40s onwards. Everyone else needs to be screened after age 50. In its later stages, prostate cancer can cause many of the symptoms that we've already discussed, but in the early stages, it's a silent disease and can only be detected through regular screening that includes a blood test, PSA, and a rectal examination. If any of these tests suggest an abnormality, then it might be necessary to follow up with a biopsy. Regular screening means early detection, which means more treatment options and a much higher chance of success. When it comes to healthcare, real men don't just ignore their problems. They get help from the one place that they can be sure understands their needs.
The Y Factor, dedicated to men's urological wellness. Schedule your appointment at mancenters.com.